Good morning to everybody. This is Dr. Satish Kumar Kagwad, Professor of OBG, Manvelas Hospital, Bangalore Medical College, presenting to you the cesarean section steps redefined. So, assuming that the reader of this knows the routine steps of the cesarean and might have done few cesareans or knows at least steps. Okay. Then, assuming that you know the cesarean routine steps, and also you must have seen video or you must have done cesarean or assisted, I point out the following things for the benefit of everybody. The following steps will make it a bloodless surgery. Try. The proof of the pudding lies in eating. The preloading with adequate fluids, correcting the related imbalance which is forgotten many times in the medical college, BG hospitals and district hospitals. Please emphasize on that. Syntocinon 5 to 10 minutes to ringer lactate when the patient is not in labor for 1 hour before. Before or after spinal anesthesia, take TAPS misoprostol tablet 800 microgram per rectally before operation. It doesn't cause any fetal distress, one need not worry about it. Misoprostol takes 8 to 12 minutes to act, and by that time every gynecologist would have removed the baby and started closing the uterus, by which time the misoprostol peak action would have started and the syntocinon, misoprostol and methotrexate would have a synergistic combination and prevents PPH and a bloodless surgery. Painted with betadine only, spirit to be avoided. Betadine is antiseptic, antifungal, and so spirit painting to be avoided. Using electric cautery for dissection of the tissues. After skin incision, rectus incision using blunt or sharp dissection. After incision, uterus and baby's incision on the uterus with a C incision or smile incision. After baby is extracted, instead of angles holding with we should hold the medial to the angles with Lscs or other forceps. Avoid holding the angle of the uterine incision, which is more traumatic than otherwise. Extraction of the baby slowly and naturally vaginally. Giving time for expression of the fluid. Cleaning the mouth, holding the head low, containing 2-finger chest compression. Umbilical cord opening in the metal side. Placenta gets separated fast and expelled naturally and prevents PPH. Then suction of the uterine content is occurred, sucking blunt cannula. Suturing with chromic catgut number 1 or vehicle number 1 or chromic catgut number 2, depending upon availability and convenience and the surgeon. Trying the knot after 2-3 pegs from the angle of the uterus. Always using surgical knot at the angle of the uterus. Peritoneal closure or no closure depending upon the surgeon's choice and convenience and opinion. Interrupted stitch for the muscle. Closure of the rectus sheath as usual. Only one towel 1 meter size with a long tail for covering the uterus to avoid missing towels inside the peritoneal cavity. Almost always taking out the uterus from the abdominal cavity to suture the uterus reduces the bleeding, increase the visibility, obliterate the requirements of a good assistance. Many of the anomalies of the uterus which could not have been diagnosed will be completely diagnosed. Otherwise it would be missed out. Always, as far as putting subcuticular stitch, unless fatty patient or some other condition or the emergency situation or under GA, it may be obviated. Use of misoprostol 4 tablets preoperatively, syntocinon 10 units to the drip, injection methotrexate IV as soon as the baby is extracted, as we give in the Amstel anterior shoulder methotrexate, IV IM SOS prostadine 250 microgram. It makes the cesarean section a bloodless surgery, and the decrease in the blood loss is variable from 500 ml to 750 ml, and the total blood loss in cesarean is less than a normal delivery, and it is confirmed by the research studies of the Egyptian Medical College and a London Bartholomew Hospital. So I